So you've been told that you have inflammatory bowel disease and you're trying to figure out what to eat. That is probably the question that I get the most often from my patients. So IBD is inflammatory bowel disease, and it constitutes either Crohn's disease or ulcerative colitis, which are diseases where there's inflammation on the inside of the GI tract. And so it stands to reason that you should stay away from certain foods or gravitate towards other foods because of this inflammation. So let's talk a little bit about eating healthy with the diagnosis of IBD. So if you have Crohn's disease, it depends on where that inflammation is and what might drive you to avoid certain foods or, again, want to eat certain foods. The small bowel or the small intestine is in charge of absorption and all of your digestion. Your colon is in charge of eliminating and packaging up before elimination all of the waste material, as well as reabsorbing water. If your small intestine is inflamed, you're gonna want to stay away from things that you just can't digest very well. Corn, raw broccoli, raw cauliflower, raw cabbage. I talk about the trifecta of badness being the church picnic, because you're eating corn on the cob, baked beans, and coleslaw. All things that a human body is not going to digest, but just process and push through, that's going to end up in your stool. If you have Crohn's disease where there is a narrowing, or what we call a stricture, that you're going to want to stay away from big meals where a lot is delivered at once. Stay away from things that are high in residue. Again, large nuts, raw fruits and vegetables, and fruits that have peels on them, because it's just all going to sit there right at that area of narrowing, and you're going to feel bloated and burpy or irpy, or you're going to have nausea and vomiting. If you have inflammation of your small intestine that is active, that trying to eat heavier foods with lots of protein are just not going to be able to be digested, and that you're going to end up with diarrhea. What do we tell a patient who has Crohn's disease? Is that, again, it's based on where that disease is and how active it is. So there is no one diet for Crohn's patients. There are certainly tenets to live by, that you don't want to be on such a restrictive fad diet that you lose weight and that you lose health because you are denying yourself the healthy things that you can actually absorb or that you should be eating. You want to stay away from things that are going to make you feel worse. What do we know about foods in general? That processed foods have more chemicals in them, that have more unnatural things that our body doesn't know what to do with. And so a diet that is based more on fresh grains, fresh fruits, fresh meats, and fresh vegetables is going to be healthier for everybody, whether you have Crohn's, ulcerative colitis, or neither of these things. We know that red meat in particular is very high in inflammatory types of entities, and that they don't have a lot of antioxidants in them, and also have the bad fats. So minimizing red meat is what I always counsel to my patients. Completely eliminating it isn't necessarily smart or what you want to do, but trying to minimize red meat, and when you eat it, to eat lean red meat rather than fatty red meat. If you have ulcerative colitis, it's the lining of your colon which is inflamed. Your colon is in charge of processing waste and absorbing water. So why do you have diarrhea when you have ulcerative colitis? It's because the water can't be reabsorbed. Why do you see food in your stool when you have colitis, or even if you have Crohn's? It's because it wasn't absorbed or processed. So just imagine that if you have an inflamed lining of your colon and you eat something that can't be processed by your body. So peanuts, raw celery, raw broccoli, beans, that those are all just going to pass through your colon, not be absorbed, not be digested, and it will give you diarrhea. The analogy that I use with my patients is a cut on your hand. Are you going to put salt or lemon juice on that cut? No, because it's going to make it hurt worse, but it doesn't make it heal any slower. So when you have colitis and you eat certain things, you may feel worse because that food is just trying to get through you, but it's not going to make your colitis worse. And so when we talk about diets for ulcerative colitis, we talk about trying to minimize foods that may be irritant to the lining, but aren't going to necessarily be bad for you, but you're just going to feel worse. So that's when patients think that their colitis is worse. No, it's just that you feel worse because of that food. So go back to that analogy about the salt on your wound. What we do again understand is that processed foods, and particularly processed corn syrup and sweeteners, have extra chemicals in them, and those are not good for people and can actually cause inflammation. So we try to counsel our patients that if you're going to have food, that try to have it that has natural sugars in them rather than corn syrup, high fructose corn syrup, and sugar substitutes that are just pure chemicals. For ulcerative colitis, you don't want to be on a restrictive diet such that you're losing weight. I have multiple patients who, because they're ill, don't want to eat because it just drives their bowel habit. I get it. But then let's try to figure out how to control that inflammation so that you can eat. The other thing that I want people to understand is that when your IBD is in remission, meaning there's no active inflammation and that there is no stricturing or narrowing that's physical in your small bowel, that you can pretty much eat a healthy diet that includes all of the different ranges of fruits and vegetables. Again, you might want to stay away from large amounts of fresh fruits and vegetables and certainly the peel, but you shouldn't restrict yourself or feel like you have to restrict yourself when you are thinking about dietary choices. There's a difference between nutrition and diet. So diet is what you put in your mouth, and nutrition is what your body needs in order to function in pure health. So I definitely tell all of my patients that they should be on a multivitamin per day, and whether that's a capsule, whether that is a liquid, or whether it's a chewable gummy, I don't care. Just make sure that you get one in. And it should have just 100% of everything that you need. You don't need 4,000% of any particular nutrient. We understand that there are patients who have small bowel Crohn's disease that if they are on certain diets, that they can manage their disease without other medications. They're called enteral diets, which means it's pre-digested food that you are eating. And so that sounds pretty gross, right? So that these are entities that don't taste good, but are pre-digested and pre-chewed for you and don't require your bowel to work. And so you're basically resting your bowel, but still able to put something in your mouth. These do work, but they're not very sustainable just because you do want that piece of pizza. You do want to go out and have a cup of coffee with your friends at the coffee house. We do understand that diets like the Mediterranean diet and the specific carbohydrate diet are diets that are very limited in processed foods, and that the sugar is coming from pure cane sugar or from honey rather than high fructose corn syrup. And so these diets are endorsed to help patients be healthier and to not make their disease worse. Are they a cure? No. Are they a treatment? They are in combination with other medical therapies. The enteral diets can be therapy in and of themselves, but the diets where you actually eat food are considered complementary and in conjunction with medical therapy in order to maintain or to achieve health. There's a lot going on in this space, and that not one diet fits all, which is why you can see 50 books out there. Not one diet is a cure, but there are ways to individualize a diet so that you have quality of life and don't affect the inflammatory state of your bowels.